Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Oscar in here with us again today. We saw Oscar for the first time yesterday.
Yes, sir.
And we spent a lot of time in the history and examination yesterday because Oscar has been diagnosed with Cauda Equina syndrome. He has had an injury back in 2021 that he had severe low back and leg pain and numbness and tingling down into his groin region, his anal region. That's called saddle paresthesia or saddle anesthesia. So he's already got like the worst possible neurological symptoms, and because he's had the loss of bladder bowel function control bad since 2021, but it actually got a little better in that time frame too.
Yes, sir.
And he has elected not, he's been told he needs to have, how many neurosurgeons have you seen?
3.
You've been told 3 times you
Yes,
have
sir.
to have surgery.
Yes, sir.
Or you're going to what?
Possibly never walk again, or that's what I was told.
Have
multiple
permanent
times.
neurological problems to your bladder and bowel.
Yes, sir. Permanent damage. Never be able to function or run or do anything like that again.
Which we discussed that in detail yesterday because we
Yes,
did
sir.
a detailed consent to treat, and
Yes, sir.
we did that verbally with you as
Yes, sir.
well. In my clinical mind, and I've talked to neurosurgeons about this, his neurosurgeon even said he didn't have a problem with him getting this done.
Yes, sir.
Because what he was going to be doing is decompressing the spine in
Yes, sir.
surgery. This is just a non-surgical decompression of the entire spine on the y-axis. Now yesterday was his very first one, and he felt it all the way down to his sacrum
Yes, sir.
on that very first one.
Yes, sir.
Show him your foot drop because that's an important feature of Cauda Equina syndrome. Tiptoes only.
Tiptoes only.
Now, you'll notice he can't even hold his left one up at all. That is officially foot drop. His heel walk, however, let me turn around. I don't want you walking backwards. It's hard enough anyway, right? His heel walk's okay. He doesn't have a total loss of dorsiflexion. Good. So, but here's my clinical analysis on his case of Cauda Equina specifically. He's had bladder and bowel dysfunction already since 2021. He's had permanent, what I consider permanent anesthesia or paresthesia in around his groin and anal region. And those are really the most serious consequences that neurosurgeons and orthopedic spine surgeons use to evaluate whether to do surgery on people so they can catch that within the first 12 to 24 hours
Yes, sir.
to prevent you from having permanent neurological issues. But in Oscar's case, he's already got those permanent issues. And if we can help him by manually decompressing his entire spine on the y-axis and him get some function back and a semblance of living healthier,
Yes, sir. Definitely.
I mean, you told me that's what you were interested
Oh, that
in.
is the goal. Yes, sir.
And he understands all the permanent stuff. I mean, we've really just been really clear about our communications and
Yes, sir.
talking to him. I told him there are risks, and the risk is, you're going to hurt worse afterwards. You could have continued paresthesia and anesthesia in your anal regions and groin regions, as well as the foot drop. But he's already got all that. It's already chronic and it's permanent. So,
Definitely very promising though with the strength that I gained from
yeah,
the first
I mean, just that very
session.
first one. Yeah.
Yes, sir.
And this will be his second y-axis, Johnson y-axis adjustment. So let's go ahead and lay on that table again now. You know, most chiropractors won't touch a patient who has Cauda Equina. I'm not most chiropractors. After careful history and examination and talking to a neurosurgeon
And Oscar,
about
you
this.
had reported too that you had started to feel some sort of sensory information down in the saddle region yesterday after the adjustment too.
Yes, sir. After the adjustment, I did feel a little bit
Less numb.
less numb in the saddle region.
Yeah.
So all those are
specifically-
indications to go forward with the treatment and
specifically
continue to.
testicle, and then a little bit of more strength in my left foot where I have the drop foot.
Awesome.
It's a lot better than it was yesterday.
Well, your walking's better. Your
Yes,
gait was better.
Gait was
this morning.
better, strength and
Yeah, just your overall well-being.
yes,
right?
sir. Sensory motor.
So we've made a clinical decision, and he's agreed to do this 3 times in a row, which we're gonna see him this morning and we're gonna see him one other time this afternoon. We already saw him yesterday, so that's 3 times. If by that 3rd time he's not functioning any better in any of those categories, then I would send him back to the neurosurgeon to go ahead and have the spinal decompression surgery. But he's still not gonna get back his bladder valve dysfunction, or he's not gonna get back his foot drop in most cases, because I believe that at this point in time, having those since 2021, they're permanent disabilities, impairment. Wouldn't you say, Tristan?
Yeah.
So, I know I'll catch a lot of hell from chiropractors. Oh, you shouldn't be touching Cauda Equina syndrome, but if you think about spinal decompression surgeries, and this is just a manual way of doing that same thing, decompressing the spine on that y-axis. I don't see any harm in doing it. He's not going to get worse than what he already is.
And the fact that he's already benefiting from it
He's
is
already
an
benefiting,
indication to
that's
keep
correct.
going forward with it.
Okay, lift your head up for just a second for me. There you go. Now lay it back. Remember to keep your teeth together so you don't bite your tongue. I just want you to focus on your breathing. Yes, sir. Boy, oh boy. Deep breath in through your nose, out through your mouth.
Big breaths. Those legs relax.
Deep in through your nose, out through your mouth. Keep doing that. Now, yesterday, he didn't have any patellar reflex. He's got a little patellar reflex on each side down. The left one a lot more so.
Yeah.
You see the difference in that today, too?
The left definitely.
Yes. Push against my hand. Pull up. Turn in. Turn out. Push. Now that's a lot stronger. You weren't even able to do that yesterday.
No, sir.
Pull up. Good strength on extension. In towards me. And now outer. He's got good 5x5 strength on his lower extremity muscle test, with the exception of the S1 nerve in flexion of the big toe and the foot. Okay, good job. That wasn't as bad as yesterday's, was it?
No.
I told him yesterday we ripped through a ton of scar tissue that had been developing in and around his motor units in his entire spine. And you felt that too, huh? You found out why it was called ring dinger. Let me help you up. Very good. Now he's an athletic trainer for universities, football teams, right?
Yes, sir. Previously, yes.
Yeah.
Did 6 years in college, and now I'm in a high school.
In fact,
setting.
you had Tristan as one of your
Dr. Went was an athlete at Sam Houston when I was there.
Yep.
Spent lots of time with Oscar.
Okay, come over here so I can shoot you again. You're still in Houston. That's a
little
bigger
more
smile
sore
than
today?
you had going yesterday
Oh,
too,
yeah.
man. Ooh,
Little
look
more.
at how we opened that up.
Oh yeah.
You didn't have any of that space yesterday.
Felt definitely taller.
Yeah.
I always wanted the marketing department to add an inch to my roster height on the football team, but they never did.
There we go. Okay. Do you remember your homework?
The
Shoulders up back first.
Yeah.
shoulders back.
And then retraction
Retract that head and look back.
and then extension. Yeah.
There we go. Now I'm not putting him into lumbar extension there. We're doing all the extensions in his upper thoracic and lower cervical spine. Relax. Walk around, walk up and down the hallway here, just so Kristen can film your gait. See, he's pushing off his toe a little bit.
Mm-hmm.
You don't have that waddle today.
Yeah, I can.
Does it feel like you can
definitely
push
feel
more
the
off?
foot, push off the foot, like it feels
Yeah.
a little bit more normal.
And that'll be the big thing on that 10-minute walk after the adjustment
Yeah.
today, is really trying to focus on that push off with those toes.
That 10-minute brisk walk right when you leave here before you sit down will help accelerate and amplify the neurology in your brain.
Still there, but it's I do feel
Well, you got
more
some
strength.
you got
yeah,
some strength in there,
for
which
sure.
you
This
didn't
is
have
where-
any at all yesterday.
This is where the aquatic therapy would start to be really
Yeah.
beneficial as well, to start working on strengthening those
I know
muscles that
this one
haven't
was a
had
big
proper
one yesterday
function.
too.
Yeah, look at that. See, he can't do it all on the left side.
Yeah.
But both.
And see, those muscles
But
haven't
when he does
been,
both, he's got a little strength.
and the fact that you haven't had communication with those muscles in a long time,
No,
that's
definitely.
where the
Well, that's
10-minute
part
brisk
of the
walk and
permanency
then,
of the
yeah.
neurology I was talking about too.
Yeah. But even if you could get in pretty quickly to start working on some of that aquatic training stuff to work on the strengthening now that we're getting the spine decompressed as well.
Definitely.
Yeah.
You know, I should say, accepted him as a patient yesterday, even knowing how serious his condition is and that this is contraindicated in most of the profession. But we're not doing that side twisty lumbar roll on him, causing a rotational exacerbation of the herniations.
Definitely.
It's all just decompressing. So I'm perfectly fine with it. I mean, I take my shots. I've taken them for years, but this could be an entire paradigm shift for patients with Cauda equina and chiropractors in their treatment and evaluation and treatment of it as well.
Yes, sir.
Because this is manual spinal decompression on the y-axis. The same thing that a spine surgeon is doing to decompress your spine, we're doing non-surgically.
Sir.
So, would you, talking to people that have been diagnosed with Cauda equina syndrome, has this at all hurt you in anything that we've done?
Absolutely not. I mean, like I said, back in 2021 when I first had the initial injury, so to speak, every neurosurgeon told me that I was going to have surgery. I would never get out of the bed that I was laying in at the time.
Right.
I refused surgery twice. Talked to several spinal surgeons who said, depending on whether it's a full laminectomy or if I'm just going to get some type of, decompression in general from the spinal stenosis.
Well, laminectomies are decompression.
Yes, sir. Yeah. And then, but I refused both times to have surgery. The first time it took me, like I said, 6 months to 8 months to walk again without a walker. And then I kind of told myself that I was going to prove it wrong and try to do my own rehab and strengthening and stuff like that. And then when this happened again recently, I refused surgery again, and I said, I think we just need to, make some different.
Well,
steps
and I came to my clinical decision regarding his treatment yesterday after we talked for over an hour. I'm just in the history.
Yes, sir.
That he's already got the permanent features of neurology issues because he's had this since 2021.
Yes, sir.
There's just really nothing that we're going to do to him that's going to exacerbate
No, definitely.
his
That's why
issues.
That's why all the people asking right now. That's why you didn't see him on the drop table today.
Yeah,
too.
and you
That's why
notice
we're
I
only
didn't do
doing
any of the other Z and X axis adjustments on the biophysics table. We're just doing the Y axis only, and that we're going to continue that with another one this afternoon. But
And currently, right now, I'm starting to feel sensation, blood flow from
Into your feet?
from waist down. Like right now,
Wow.
I can tell you.
that's
awesome.
the first thing I feel when I have
Yeah.
that done.
And then
That's awesome.
like yesterday, when after I left here and was driving, I called my my brother and I said I actually feel blood flow, things that I haven't felt in a long time, kind of reaching
awesome.
down. I feel a sensation, warmth,
Yeah.
kind of going down my leg.
And that's
the
exactly
only
what
way
I
to
felt
really
too.
verify that scientifically would be with a thermogram,
Yes, sir.
tomography examination of your legs and your feet.
So
But still, I mean, hey, every time I get it done, I feel the blood going down into my feet, and I have peripheral neuropathy, same as you.
so
He also has been diagnosed with peripheral neuropathy and has type 2 diabetes, which he's under care from a medical doctor on.
yes, sir.
So we're going to give it a whirl for him. I mean, he's the patient. It's his life. He's already declined surgery, knowing that that's the last resort. And we're more than willing to help people as last resorts in here if we can. If it's safe, and we think that we can be effective in helping assimilate some type of function that's an improvement for your health and well-being, we're willing to work.
Yes, sir. Definitely.
Well, thanks for sharing
Thank you
your
so much,
experience.
Doc. Yes, sir.
This could be a big paradigm shift for the chiropractic profession,
Yes,
so
sir.
you might be making history with this.
Well, thank you so much.
Yeah,
I
you're
appreciate
welcome
it.
so much. My pleasure.
Thank you, Dr. Wayne.